first and most critical step in responding to a stroke is the ability to recognize it as it begins, a skill that is both simple and profound. The human body often gives subtle warnings before and during a stroke, and understanding these signals can mean the difference between minor impact and irreversible damage. Seniors in particular are at higher risk due to changes in the cardiovascular system, blood vessels, and overall neural resilience, making early recognition not just important, but essential. The nervous system communicates distress in ways that are sometimes obvious, but often easy to overlook. Sudden numbness in the face, arms, or legs, an abrupt difficulty in speaking or understanding words, unexpected visual disturbances, or a noticeable droop on one side of the face. These signs are the body's way of alerting the brain and the person to an internal disruption, a subtle language that requires attention, mindfulness, and rapid interpretation. Awareness of these warning signs is an active form of prevention. The body is not merely passive during a stroke. It is attempting to signal dysfunction to the individual. By training oneself to recognize these cues, seniors can act immediately, calling for help and implementing protective measures before secondary damage occurs. The brain itself is capable of plasticity and adaptation, but only if the disruption is addressed quickly. Each minute of delay increases the risk of irreversible neural death. Yet even a small awareness of early warning signs can accelerate response time dramatically. Recognition transforms a person from a passive observer into an engaged participant in their own survival. It is also important to understand that these signs can vary in intensity and presentation. For some, the numbness may be mild, a tingling or weakness that seems transient. For others, speech may be slurred or fragmented in ways that initially appear as simple fatigue or confusion. Visual changes may be subtle, momentary blurriness, double vision, or loss of peripheral awareness. The challenge lies in interpreting these signals correctly, resisting the tendency to dismiss them as minor or temporary, and responding decisively. Education and repeated mental rehearsal of these scenarios are critical. When seniors familiarize themselves with the spectrum of stroke symptoms, their nervous system becomes primed to detect deviations from normal patterns, enabling rapid recognition and immediate action. Another important factor is the understanding of personal risk. Seniors who are aware of underlying conditions such as high blood pressure, atrial fibrillation, diabetes, or previous minor strokes can appreciate the heightened importance of vigilance. This awareness enhances the sensitivity to bodily signals, creating a heightened state of readiness that allows the individual to respond without hesitation. In effect, the body's warning signs are amplified by prior knowledge, and the mind becomes an active partner in early detection. Finally, recognition is not only a biological response, but a psychological skill. Fear or denial can delay acknowledgement of symptoms, yet cultivating calm attentiveness allows the brain to interpret signals clearly and the body to act efficiently. The subtle balance between mindfulness, knowledge, and quick decisiveness forms the foundation of early stroke intervention. By observing the body's signals, interpreting them accurately, and acting without delay, seniors can harness the first critical moments of a stroke to preserve function, to protect neural tissue, and dramatically improve the odds of recovery. In the moments following the onset of a stroke, the positioning of the body plays a critical yet often overlooked role in influencing outcomes. The human brain relies on continuous regulated blood flow to maintain function, and any interruption, partial or complete, can rapidly lead to cellular damage. While emergency medical care is essential, the minutes before help arrives represent a window in which small, deliberate actions can support the brain and reduce the extent of injury. One of the most effective strategies involves adjusting posture to optimize cerebral circulation, a principle grounded in the interaction between gravity, vascular anatomy, and hemodynamics. After a stroke begins, the affected blood vessels may be partially blocked, causing reduced oxygen delivery to specific regions of the brain. Sitting upright or slightly elevating the head can facilitate the flow of oxygen-rich blood to these vulnerable areas. This posture reduces intracranial pressure while maintaining perfusion through healthy vessels, helping to preserve the function of neural tissue. Even subtle adjustments in alignment, such as keeping the shoulders relaxed and the spine supported, can influence the efficiency of circulation. These movements are not strenuous. Rather, they are intentional, measured interventions that respect the body's need for stability while maximizing its capacity to self-preserve. The connection between posture and cerebral health highlights the intricate integration of multiple systems. The cardiovascular system, guided by the heart's pumping action and modulated by autonomic responses, works in concert with the vascular structure of the brain to deliver oxygen. Muscles and connective tissues contribute indirectly by supporting the position of the torso, neck, and head, ensuring that vessels remain unobstructed and blood flow is unimpeded. By understanding these relationships, seniors can take simple steps, just in their seated position, avoiding slumping or twisting, keeping the neck and shoulders aligned to optimize the body's natural compensatory mechanisms in the earliest stages of a stroke. Another consideration is the importance of avoiding strain. Attempting to stand, walk, or reposition oneself in haste can exacerbate injury by increasing blood pressure fluctuations or dislodging partially blocked vessels. Controlled, minimal movements that maintain an upright or slightly reclined seated position balance the need for circulation with the imperative to prevent additional stress on fragile vessels. This careful approach reflects a nuanced understanding of the body as an interconnected system, where posture, blood flow, and neural protection must be managed simultaneously. Furthermore, this strategy can enhance the efficacy of any subsequent interventions by medical personnel. When emergency responders arrive, a patient who has maintained an optimal seated or semi-reclined posture is more likely to have preserved neural function and reduced secondary complications. This preparatory action, taken in the first 3 minutes, creates conditions in which the body's remaining resources can be leveraged most effectively, allowing for a smoother transition to advanced care. Ultimately, the deliberate use of posture in the early moments of a stroke underscores the principle that the body can be guided to protect itself when knowledge and awareness are applied. By understanding the interplay of blood flow, neural oxygenation, and skeletal support, seniors can use simple, intentional adjustments to preserve function, reduce risk, and give the brain the best chance of resilience until professional help arrives. In the critical first moments of a stroke, the way we breathe can profoundly influence the body's capacity to cope with the sudden disruption in blood flow to the brain. Oxygen is the lifeblood of neural tissue, and even brief reductions in delivery can accelerate cellular injury. Conscious, controlled breathing is a tool that seniors can use immediately before professional help arrives. To support the cardiovascular system and optimize oxygen availability, the act of slow, deliberate inhalation and exhalation engages more than the lungs. It orchestrates a subtle coordination between the heart, blood vessels, and nervous system, stabilizing vital functions at a moment when every second matters. When a stroke occurs, the brain experiences a sudden imbalance. Oxygen delivery is compromised, and the nervous system enters a state of stress. This can trigger rapid changes in heart rate, blood pressure, and vascular tone, which, if left unmanaged, may exacerbate damage. By focusing on slow, controlled breathing, seniors can influence these physiological responses. Deep, steady breaths increase oxygenation in the blood, supporting the limited flow reaching affected areas of the brain. At the same time, this controlled rhythm sends signals to the autonomic nervous system, helping to calm the fight or flight response that can otherwise elevate blood pressure and strain fragile vessels. The mechanics of this process are elegantly interconnected. Inhalation expands the lungs, drawing oxygen into the alveoli, where it diffuses into the bloodstream. Exhalation removes carbon dioxide, maintaining acid-base balance, which is critical for optimal cellular function. Each breath becomes a mini circulatory boost, enhancing the efficiency of blood flow and providing the brain with the resources it needs to resist injury. The heart responds in tandem, adjusting rhythm and pressure to match the controlled breathing pattern, while vessels throughout the body react to maintain perfusion to essential organs, including the brain. Even small improvements in oxygen delivery at this stage can influence outcomes by preserving neural tissue that might otherwise succumb to ischemia. In addition to the physiological effects, conscious breathing has a stabilizing effect on mental focus. Panic or fear can disrupt coordination, increase muscle tension, and impair decision-making. By centering attention on a slow, steady breathing pattern, seniors engage cognitive control over the body's automatic responses, reducing the likelihood of erratic movements or unnecessary strain. This mental calm complements the physical benefits, creating an integrated response that enhances resilience and preserves function. Importantly, this technique does not require training or equipment. It is accessible, immediate, and safe, making it particularly valuable for seniors who may be alone when a stroke begins. By combining posture awareness with controlled breathing, the body's natural systems are supported and the limited oxygen supply is used as efficiently as possible. This intervention, while seemingly simple, reflects a sophisticated understanding of how the respiratory, cardiovascular, and nervous systems interact, illustrating that even in moments of crisis, the body can be guided toward preservation and stability. Ultimately, conscious breathing transforms a moment of vulnerability into an opportunity for intervention. It reinforces the principle that the human body, even under acute stress, can respond to deliberate, informed actions. By supporting oxygen delivery, stabilizing heart rate, calming the nervous system, controlled breathing provides seniors with a tangible, immediate method to protect neural function and maximize resilience in the first crucial minutes of a stroke. In the immediate moments following the onset of a stroke, the positioning of the limbs and the use of subtle pressure points can play a surprising yet significant role in supporting the body. The vascular system, composed of delicate networks of arteries and veins, is under sudden stress when blood flow to the brain is compromised. Gentle adjustments to limb position can influence circulation, reduce unnecessary pressure on compromised vessels, and help maintain stability in both muscular and neural systems. While these actions are simple, they are grounded in the complex interplay of anatomy, hemodynamics, and neuromuscular coordination, offering seniors a practical tool to mitigate damage before emergency care arrives. Elevating an arm slightly, for instance, can encourage venous return and reduce pooling of blood in the extremities, allowing more efficient circulation toward the heart and ultimately the brain. At the same time, keeping joints relaxed rather than tensed reduces strain on surrounding muscles and tendons. When muscles are excessively contracted during stress or panic, they can compress blood vessels and restrict the already limited blood flow. By maintaining relaxed but intentional positioning, seniors can help preserve both arterial and venous function, providing the brain with a better chance of receiving oxygenated blood through available channels. Gentle limb positioning also supports neural pathways. Muscles, tendons, and joints contain sensory receptors that communicate constantly with the brain about position and tension. When limbs are placed thoughtfully, without awkward twists or compressions, the nervous system can interpret signals more effectively, maintaining a degree of proprioception and motor control even during the stress of a stroke. This awareness allows the body to stabilize itself subtly, reducing the likelihood of secondary injuries such as falls, sudden jerks, or overstretching of weakened tissue. Every careful adjustment, even of a finger or hand, contributes to a more controlled environment for the body while it waits for professional intervention. Pressure points often associated with clinical or therapeutic applications can also be leveraged in simple ways. Light, deliberate pressure applied to areas such as the forearms or legs can help guide circulation and provide sensory feedback that reassures the nervous system. This feedback can calm involuntary muscle contractions or tremors that sometimes accompany the onset of a stroke. The principle is not to manipulate the body aggressively, but to use awareness and subtle physical guidance to support the body's intrinsic compensatory mechanisms. Equally important is avoiding positions that impede circulation, crossing legs, compressing arteries, or holding the head or neck in a strained posture can further reduce blood flow and exacerbate ischemic conditions in the brain. Simple guidance keeping the limbs slightly elevated, the spine aligned, and joints relaxed maximizes the efficiency of the body's limited resources. In combination with controlled breathing and upright posture, these adjustments form a holistic approach that uses knowledge of anatomy and physiology to protect vulnerable tissue. By understanding the relationship between limb positioning, pressure, and circulation, seniors can actively support their own bodies in the earliest moments of a stroke. These small, deliberate actions illustrate how thoughtful, minimal interventions can preserve function, enhance stability, and reduce secondary complications, giving the brain the critical support it needs until professional help arrives. Preparation and mental clarity are among the most powerful tools a senior can employ in the event of a stroke, transforming a moment of vulnerability into an opportunity for controlled, life-preserving action. The human body and brain respond to crises not only through automatic physiological processes, but also through conscious decision-making. And the combination of knowledge, awareness, and calm focus can dramatically influence outcomes. Seniors who cultivate familiarity with their personal risk factors, the warning signs of a stroke, and the steps to take immediately are better positioned to act decisively, rather than react in panic in the first crucial minutes before help arrives. This preparedness is not theoretical, it shapes the body's response in real time, aligning posture, breathing, and subtle movements with optimal protective strategies. Mental clarity begins with education and repeated rehearsal. Understanding the symptoms of a stroke, the sudden numbness or weakness, difficulty speaking, visual disturbances, and facial drooping creates a mental map that the nervous system can rely upon under stress. The brain, even while under threat, is capable of recognizing these signals quickly if it has been trained to do so. By mentally rehearsing the steps to take when these signs appear, seniors can create neural pathways that reduce hesitation, increase response speed, and ensure that each action taken is purposeful. This mental preparation transforms fear into directed energy, allowing the body's physiological systems to function in harmony with conscious decisions. Knowing one's own risk factors enhances this mental readiness. Seniors with conditions such as hypertension, atrial fibrillation, diabetes, or a history of cardiovascular events have an amplified need for vigilance. Awareness of these vulnerabilities heightens sensitivity to subtle bodily changes, making early recognition more likely and immediate action more instinctive. When the mind is attuned to potential warning signs, it can coordinate with the body's motor and autonomic systems, guiding posture, controlled breathing, and limb positioning in a way that optimizes cerebral perfusion and reduces stress on compromised blood vessels. Mental clarity also plays a critical role in calming the autonomic nervous system. Panic or anxiety can trigger rapid increases in heart rate and blood pressure, adding strain to fragile vessels and exacerbating injury. By focusing the mind on deliberate steps calling for help, maintaining posture, breathing slowly, and adjusting limb position, the nervous system is guided towards stability rather than chaos. This creates a feedback loop. The calmer the mind, the more effectively the body can implement protective measures. And the more effectively the body functions, the calmer the mind becomes. Finally, preparation fosters confidence, which in itself is protective. Seniors who have rehearsed what to do in the event of a stroke are less likely to freeze, overreact, or make movements that could worsen the situation. The mind acts as a guide, directing the body to use its limited resources efficiently, conserving energy, and maximizing oxygen delivery to vulnerable neural tissue. In this way, the combination of mental clarity, rehearsal, and awareness becomes a form of proactive resilience, allowing seniors to navigate one of life's most critical emergencies with intention, calm, and a measurable chance of preserving function. In the final moments before help arrives during a stroke, the integration of all preparatory actions, recognition of symptoms, posture, controlled breathing, and limb position culminates in a profound opportunity to preserve life and function. The body, even in crisis, retains the capacity to respond intelligently when guided by awareness and deliberate action. Seniors who have cultivated both physical and mental strategies can leverage the first few minutes to optimize cerebral oxygenation, reduce stress on vulnerable blood vessels, and maintain stability, giving the brain its best chance to survive the insult and limit damage. This integration reflects the remarkable adaptability of the human body, which, when supported with knowledge and intention, can maintain critical functions even under severe stress. Each system of the body contributes to this early response. The cardiovascular system works to distribute oxygenated blood, while the respiratory system ensures efficient gas exchange. Muscles and connective tissues provide structural support, facilitating optimal positioning for perfusion. The nervous system monitors the body's status, coordinating subtle adjustments in tension, posture, and movement. When these systems are guided by conscious, deliberate actions, such as maintaining upright posture, performing controlled breathing, and gently positioning limbs, they operate more efficiently, preserving as much function as possible. The body is not passive in this process. It is actively capable of compensating and adapting when given the proper signals. One of the most powerful aspects of this approach is the interplay between physiological and psychological responses. Panic and fear are natural during a stroke, yet they can exacerbate neural damage by raising blood pressure and triggering erratic muscle contractions. Mental clarity allows seniors to engage in purposeful action, aligning thought with movement. Each conscious step raising the head slightly, relaxing the limbs. Focusing on steady breathing is a form of guidance for the body's systems, telling the heart, vessels, and muscles how to respond optimally. In this way, preparation and awareness become more than cognitive strategies. They are tools that influence real physiological outcomes. Consistency in practicing these strategies before an event occurs reinforces the body's responsiveness. Repeated mental rehearsal, familiarization with the warning signs, an understanding of protective actions prime the nervous system to react swiftly. When the first subtle symptom appears, the brain can interpret the signal quickly, triggering coordinated adjustments in posture, breathing, and circulation. These automatic yet informed responses minimize delays, reduce risk, and enhance the effectiveness of each protective action. Seniors are not merely reacting, they are applying practice strategies that integrate knowledge, awareness, and bodily guidance in real time. The culmination of these efforts demonstrates a fundamental principle. Even under acute physiological stress, the human body remains capable of adaptation and resilience when guided with intention. The first 3 minutes of a stroke, often considered the most critical, can be transformed from a period of helplessness into a time of informed, purposeful action. By combining awareness of symptoms, deliberate posture, controlled breathing, mindful limb positioning, and mental clarity, seniors can optimize oxygen delivery, stabilize the nervous system, and preserve critical neural function. These actions, though simple, leverage the body's natural compensatory mechanisms, illustrating that preparedness, knowledge, and calm decisiveness can profoundly influence the outcome of one of life's most urgent emergencies.